So we're going to be the ones in the room, and we're going to be asked the role of technology can play in addressing this crisis. What do you think are some of the things that you're seeing out there from a technology perspective or from technology partners that may help in addressing this challenge, do you think?
No, it's an excellent question, Bill, because you think about the fact that that first, you got the med adherence, but med adherence isn't about taking your opioids. Med adherence is about making sure you're taking your statins and other things that we're being measured on. So you think about the reconciliation process when a patient leaves the hospital or even leaves a post-acute setting, what that follow-up looks like and what kind of education materials we can give to them, whether it's a patient portal or another SMS push technology or messenger service that allows us to be able to say, here's the education behind your opioids, and here's what you should do if you don't need all of them. Like, here's how you can get rid of them. Or if you do need them, here's how we can call you and get you really in the care management plan that helps to manage your pain or manage the issue that's at hand. But there's a few things that are in flight. There's the Overdose Protection and Patient Safety Act that allows us to manage opioid records, but they don't necessarily get shared because of HIPAA. And so how do you create opportunity for drug treatment or diagnoses that are out there in the EHRs to be interoperable to share those specific details? Because you get this blob of data in a CCDA, you're not going to go look to see, hey, Bill got fentanyl for this at one point. So there's the interoperability, there's the ability to share the drug history records. Telehealth to me continues to be a space where if you can, so like you think federally qualified health centers aren't allowed to bill for telemedicine right now. And a lot of the people in the US that have an addiction to opioid may go to those locations for care. And if there's not a way for that provider or for that patient to be able to have access to either maybe a behavioral health advocate or someone who can help them manage that care more effectively in a setting of where they are, then we're going to continue to put ourselves at risk at some of our most vulnerable populations. So using the tools we already have, just making them very specific to something that's been identified as a very worthy cause.
Yeah, and I like the aspect of education here, I think is really key. Sometimes recording those conversations that the physicians have at the end where they're giving the care plan and the care instructions, recording those and putting those into a portal so that they can be watched later. I know that with my family, I'd like to see what the doctor actually said because I'm not in the room, and they're like, well, I don't know what she said. She said this and this, and I'm like, oh man, so how do we know what's right? So recording those things is interesting. I think that one of the more interesting things I've seen in my career was I saw a design agency that worked with a hospital in Chicago, and they took their discharge documents and they did, I think, like a 90-day program with them and design thinking and really redid the discharge. And they gave, I wish I had a copy, but they gave me a copy of it. In fact, I know who to reach out to. I'm going to reach out and get it because it's phenomenal that they took this really complex, 5-page thing that they handed somebody and they made it into a front and back, color coordinated, really interesting pictures. And I just looked at it and I'm like, and they said, 5th grade reading level. And I looked at it, I'm like, yeah, it's pictures. And it was very clear what I was supposed to do. And I think it was for asthma. And I was like, it's very clear, when I'm supposed to just, take my inhaler. It's very clear when I'm supposed to go to an emergency room. And that kind of thing, maybe not falling within technology, but the whole idea of bringing design thinking into the organization is something that IT really can facilitate and help with, I think.
Oh, absolutely. And you think about when if you know a patient has a prescription for an opioid, it's some of those like in your face numbers, like, we don't want you to become a statistic. 72,000 people a year are dying from this as an addiction. And here's what we're going to do to make sure that you only take this as long as you absolutely need it, kind of thing. Yeah.
Yep.